Hello, I'm Kim Hendricks, Communications Director in the College of Human Sciences. Welcome into the halls of Spidle. This is where you meet students, researchers, faculty, all through their work and studies. They're taking life-changing steps up and down these hallways, improving quality of life for those around them. Our topic today, stress. The stress that we're all feeling to some degree during this pandemic season. And our guest today is Dr. Scott Ketring. Thank you so much for joining us.
Well, it's a pleasure to be invited.
Absolutely, and we'll keep our distance as we walk down this hall again. But Dr. Ketring is Associate Professor in Human Development and Family Science, and he's also the Director of Auburn University's Marriage and Family Therapy Program.
Yes, I am.
With that in mind, let's back up to spring. Okay, we've just been told, here we go, students get off campus, everyone take care of yourself, stay at home, stay apart from each other.
Yep.
So our college quickly launched teletherapy. Back us up to that time and tell us why we made that quick pivot, so to speak.
We were able to make a quick pivot because I was able to speak with Rhonda Lacey, the HIPAA director at the university, and it was spring break. And so Angela Wiley, Dr. Wiley was here, and I was here, and we just started on this process. I have great colleagues, Lauren Rollman, Joshua Novak, and we just started collaborating back and forth, and we got out what the key essential elements in terms of setting up HIPAA Zoom, so that we have teletherapy that's confidential, private, and we had to readjust our informed consent. So the clients knew what they were agreeing to coming into this, and then get the therapist trained on it and move forward.
Right.
And so it was really a busy time, like 2 weeks of just a week over the break, a follow-up week, and then a practice week, and then bam, we're off.
But you all could sense early how needed this was going to be, right?
Yes.
During this season.
Yes.
Yeah, still face-to-face therapy, but online, a screen. You could be anywhere in the state and be with a therapist.
Yes, the key is we could see anybody throughout the state. So if students, faculty, community members were in the state of Alabama, we could see them. And it's at that point when the provost spoke to our dean, Dean Hubbard, and HR came in contact with us and said, can we offer services to full-time faculty and staff for free? And so we launched a program at that time to offer for faculty, staff, full-time, and their families, 12 sessions free. And so that's simultaneously something we launched to be a support to the community.
Well, let's walk along here and talk about the toll of this pandemic. It's hard to put it into words, but of course loneliness and anxiety, depression, lack of energy and focus. Tell us what all you've addressed through teletherapy, and have you seen a shift at all in how people are both hurting and coping now that we're 7 months, hard to believe, into this?
We are 7 months in, and there has been an adjustment. At the beginning, it was like the acute phase. It's something new. I mean, you just never imagined something like that happen that isolates and distance. And the literature, the research was clear that leading up to that, many Americans had voiced isolation and loneliness even before the pandemic hit. And so you just have everything in place. The pandemic hits, and people don't know what to make of it. You know, it's going to be a month, it's going to be a few weeks, and we just kept getting dates after dates. Anxiety was a big thing. A sense of isolation was a big thing. Your life was thrown off. And so a lot of therapy was very different in the beginning, and adjusting to this, do I want to do online, do I wait for services, and different people chose differently. Now we're back into this groove after 7 months. It's the new normal. And so we have huge rates of social isolation. You have loneliness. People want it to end. My daughter wakes up every morning and says, oh, why can't it be over? Why can't this be over? And it impacts different phases of your life. At first, it was annoying. And then you have real things, like my dad has a heart attack, and I can't go to inside the hospital, or other people whose loved ones have passed away. We also see clients who has a parent who have died because of COVID. And so it's a very real factor in their lives. And coming back to school, now it's even taken it to a new level, because going to college is different now.
Right, let's talk about that. I'm so proud of our college students. When I walk on the sidewalks, you don't see as many, but I'm proud of how they're making the best of where we are.
Yes.
But this is a lot. It's not the fall semester they all have been hoping for. Now you add in regular stressors, grades, tests. Maybe they're concerned about family at home because they've been affected financially or with their health. What do you say to the student who is saying, wow, this is a lot, I just can't take it right now? You know?
What we say to them is, you can't, you're right.
Yeah.
This is like, take on your normal stressors, and now we've added more to it. And so it is being honest with yourself that this is a whole lot more. And I can't do that really well without relationships. And those have even changed. People say, I check in with my parents. Southerners are really good about this. You know, call their mother.
Exactly.
There's good things with that. But this is a new normal, new caveat. And everything online at first works out. And then people get tired of that. I'm missing that interaction with people. And they crave it. College students crave the interaction. I see them on campus. People get stressed. Are they wearing their masks? And what are we doing? But there's that social feature with adolescents and college students, and it impacts them. It impacts their physiology majorly in terms of depression and anxiety.
I know you can't give us a full session right now, but what is some advice you give to that student when they call and they tell you everything you just said? How do you begin to walk them to a healthier place?
The healthier place is, one, identifying their relationship. You know, we're marriage and family therapists, couples, relationships. Relationships matter for your health. And now more than any other time, it's an easy sell. And so people slow down. You can't do everything, so you slow down, which doesn't mean do nothing, because that's what people sometimes hear. It means let's take a perspective on this, and then let's readjust and find out where we make our connections and who can help in this process. So people have real problems. You have suicidality, which is increasing. You have people that need to come in because they've experienced violence in their lives, depression, death, and then the unknown. Yeah. They're just overwhelmed with the system. And so it is, let's get an appraisal, let's slow this process down, let's get you the supports, let's talk about that and collaborate. And that's what the Marriage and Family Therapy Center does well, because we do evidence-based practice, meaning we track your change and we work with you to, hey, this is what we're doing, this is what we're facing, do you have any feedback, what are we doing? And so it's a very collaborative response.
Well, even this new relationship between yourself and a therapist, that's relieving. It gives you hope to say, I know there's someone I can call on this day and I can talk this through.
Oh, yeah.
On the other side of what our students are feeling, we have our faculty who have jumped into a lot of online work and watching higher education change right in front of your eyes. Do you give the same sort of advice to faculty right now if they call in?
Yeah, faculty have a lot of different concerns because, you know, you have kids in school, you know, most do, but you know, you're at a different stage of life. And I have children in school, I have parents who are elderly that I have to figure out how do we get them out of the home that they're in and into a safer environment. And then there's the stress of working and being older in your 50s and 60s, and what toll COVID can have on your health. And so, yes, people come in with the whole stressors of their family. This is why we offer the service to faculty or staff and their families, because your child could be reacting differently because of school, because they're doing online school and they're depressed at home, and we get more calls in about those situations. Parents worried about their children, but also their work stresses of what's happening in their life, and trying to juggle something that is at times feels unjuggable. That's not a word.
No, I like it. Makes perfect sense.
But yeah, and so it's working with people in that, and working with faculty, and I appreciate you contacting me because it gets the word out. We can have more faculty come in, we can have their families or staff, because staff is also under a great deal of stress with their daily lives of coming in and working with people, and the fear is a legitimate factor, and it's real.
Absolutely, and I hope people listening right now too are saying, oh, I'm not alone in my feelings. Okay, even that's reassuring to hear.
Yeah.
One of your colleagues you mentioned, Lauren Rollman, she wrote in an article, and we'll tell you how to read all of that at the end of this segment. Reaching out to a therapist about your own health is like reaching out to an electrician when the power is not working well in your house.
Yeah.
We don't wait on that, do we? We call the electrician. So when your health, when you feel the circumstances just bearing down on your energy and the power, so to speak, in your life, it's a very healthy, smart thing to reach out and get some help.
Yeah, and what I like with her message is many times we have family and friends that say, hey, reach out to us to say if you're hesitant or you're scared or I'm worried about you. They can also make contact. We're relationship experts.
Yes.
And that's what we like to, we will focus on that. And so it's scary for some people to make that contact. They feel weak in doing it or not strong or I don't know, my problems aren't as bad as other people's and we can make it work. And many times loved ones make the contact with them and say, hey, you should do something about this. This is a big deal. And so making that contact and moving forward is important. Our message is, yes, you need help, and if my plumber, my electricity, or something, my air conditioning, mine went out last year, and I was like, no, we're here, we're here, I can't, this is my right, I need air conditioning. But having them come out, and I didn't care what the expense was on that. This is something that is very affordable, very reasonable, and most people don't understand how collaborative and helpful it is from an immediate response within 2 or 3 sessions of resolving difficulties and problems.
It is a real sign of strength to reach out and get help. So when we do decide to connect with teletherapy, who's on the other side? Tell us about the therapist.
Yeah. All my therapists at the clinic right now, we have paid interns. So they are paid at Mental Health, Circle Care, which is out in Valley, Alabama. We have people working with programs like IMBK, which is I Am My Brother's Keeper. Our therapists work with a diverse population across the board, really excellent therapists who are paid at these placements, but they're also offering services in our clinic. And so they're master students in the Marriage and Family Therapy program. There's only 6 of them. There's per year. There's 3 faculty, very hands-on, very connected to their training process, get jobs right afterwards and get their national exams. Everything's functioning well. And people like the services. Very, very highly rated. Very good to excellent on 80% of all services. Just bam, here it is, good. And anytime there's any difficulty, we process that and we move forward. So people are satisfied.
Highly qualified therapist on that other end with you. And also any student who's still figuring out, is this something you'd want to do? You're hearing right now some of what you would eventually step into through studying in this program. You touched on this. Let's just say it again so people hear it. The cost, very low, if not free. Tell us about it.
It's free for staff and faculty and their family. For students, it's $20 a session. And that's Auburn and Southern Unions. We reached out across the board trying to work with students. It's a reasonable cost, and it's a sliding fee. The fee is $50, and if you apply for the sliding fee scale and demonstrate income levels and family size, it moves down to 20 to 50 for anybody else in the community. And we have mostly online, but we've slowly started to transition back to some people in person. We have people who've experienced suicidal thoughts, violence in their life. We have people who don't have bandwidth. They're underrepresented. We have undocumented workers that have come through, I don't have access really well. I have low-income workers that, where do I get this? Or my household, my apartment's chaotic. And then you even have older clientele that say, I understand the risk of physical imprisonment, I just don't know how to do this. And I've tried it over the few months, it's not working. And so we're trying to slowly bring in the people that have the most difficulties online to an in-person, have it be safe, and restructure it in that way. So our therapists will notify clients if they feel like they've been around somebody that's ill or they feel ill, and the clients do the same. And we have, we take your temperature outside, and so they come to it. We've had clients that we said, no, you have a fever. And so then the client went out to the car and they did a teletherapy session with Zoom, because it's all face-to-face. It's Zoom, HIPAA Zoom, and they've done their therapy session. So we're trying to create something that is accommodating to the client and safe across the board within our clinic and outside of it.
Have you had time to think about if this is something you will hold on to, even when we can put the mask away for good? We look forward to the day when we can all be right by each other all the time. Some people may react better to teletherapy than right here, right?
Well, the good thing about this is that decision's above my pay grade.
Yeah.
You know, because obviously at the state and federal levels, there was an adjustment in terms of legal requirements for training, for teletherapy, and we fall within all those guidelines. But once everything's done, there has to be some decisions made about how to do this. We're certainly excited about the possibilities because it does something different. Supervision's different when I'm online with them versus in person. Therapy's different. Some people really gravitate to that, and it aids in their reaching out. Sometimes for a group of people, it's easier to reach out online than it is to come to the building. And honestly, there's distance. If I'm in Dadeville, I'm in Alex City, there's a distance to travel, and that online facilitates it. So for rural mental health, this is a blessing, a boon. People that have needs, I don't have to go to the clinic. We could Zoom in and start this, and maybe in the 4th or 8th session, we could go in and see the therapist in person, but here it is, we have these services. I agree with you, it's changed everything, and I think the country will adapt to a new normal, and it'll be a positive thing.
I think so too. Thank you so much for your work and all that you're doing, and for taking the time today.
I appreciate it.
Really expanding this opportunity for this. I know it's life-changing therapy, and at times life-saving for people. Thank you so much.
Thank you for having me.
Sure, and if you want more information on the teletherapy program, or you want to make an appointment, you can simply go to the website right here on the screen. And for that full article from Lauren Rollman, it's called The Spillover Effect of COVID-19 Stress. You see it right there in the link as well. Until next month, thank you for joining us, and take care.